certified dermatologist with a thriving practice in Beverly Hills. You may have seen his face on one of the 35 different shows that he's appeared on.
A lot of reality TV shows.
You know, Dr. 90210, The Doctors, and you know what? You actually have authored several scientific publications.
That's correct.
As well as co-authored several chapters for medical text as well, and you're a clinical assistant professor at several universities.
Yeah, in the Department of Dermatology. So I always tell people I'm an academic dermatologist, and I like to explain to my patients the word doctor is derived from the word doctorate, which means to teach. And that's really my primary objective in my career, is to teach. And thank you so much for having me today.
Oh, you're welcome.
I didn't even say hello. Thank
okay.
you so much. My whole point is I love to teach. I love to interact with patients, and hopefully we'll get some phone calls about people who have questions about anti-aging regimes in this product line in particular.
And use your expertise. That's why he's here.
That's why I'm here.
Well, let's touch on really quickly Neutrogena Dermatologics.
Absolutely.
Because for many of our viewers, I'm sure they've said, well, I know that name, Neutrogena. I've seen it on store shelves. But this line in particular, you haven't seen on any store shelf.
That's correct. Exclusive to QVC. This is the upper echelon from Neutrogena. Neutrogena Dermatologics focuses on that unique partnership between scientists and dermatologists to give you cutting-edge solutions, continuously renewing the look of your skin. Superior anti-aging benefits is the one single best phrase that sums up this line. Superior anti-aging benefits.
Well, then let's jump right in with our first product. This is a really popular item here at QVC.
So.
And more just back in of our Retinol Wrinkle Filler. It's available on our auto delivery plan, so it'll ship out to you every 90 days. And it's a unique formulation of ingredients that actually helps to reduce the look of lines and literally wrinkles.
Correct. There's so few products out there that really treat those deeper crevices, those deeper wrinkles, those stubborn wrinkles. And the reason is they simply can't back their claims up with a product that works. And that's where this product really comes in. It has that stabilized retinol technology that you're going to hear me talk about a lot during this hour. What does that do? Increases surface cell turnover, and it gives you softer, smoother skin, more supple skin, and it helps with fine lines. But this product also contains hyaluronic acid. Hyaluronic acid is a naturally occurring substance in our body, and the beauty of this molecule, of this hyaluronic acid, is that it holds up to 1,000 times its weight in water. So I'm going to show you a little bit of a demonstration in a second, wherever you like, but go ahead, you had a question?
Well, I did want to ask, so who is this product for exactly?
I'm so glad you asked. I jumped over that. This is the Wrinkle Filler. I call it the Wrinkle Fighter, because I tell people we're in a battle. This is a battle against the process of aging, and we want to fight that battle. You could take a proactive approach and really make a difference in your skin, a difference that your friends will notice, your family will comment on. You can make a really big difference for those small creases and those deeper stubborn wrinkles.
So really, this is like that heavy-duty tool in my arsenal. If I want to fight wrinkles, fight aging, this is a great place.
It's a targeted fighter. I tell people this is not a full facial product. It's a targeted product, and you really put it on those specific areas where you have those deeper wrinkles.
And what makes this different? That unique formulation of ingredients.
The that marriage between the two ingredients.
And the hyaluronic acid. So you're going to show me kind of what hyaluronic acid actually does and how it works.
I'd love to give you a little bit of a demonstration. It's actually really simple. If you see this sponge here, this is just a hard sponge, and you can imagine that this is the hyaluronic acid. And this water here is the normal occurring moisture in the air and on the surface of your skin. And when you put the two together, well, what happens? We talked about that hyaluronic acid could hold up to 1,000 times its weight in water. So the hyaluronic acid really gives you that immediate effect of filling, as the name suggests, filling those deeper lines, those stubborn wrinkles. But you also get that continued long-term benefit because you have that stabilized retinol in there. So
this is the ingredient, the hyaluronic acid that we're using to fill.
Exactly. And it's the marriage of those two ingredients. And if it sounds complicated, I say leave the complex research and development, the technology, to the scientists and the dermatologists. It's so easy to apply, very, very simple to use. We'll show you that on one of our models, Suzanne, but it's such an easy product to use.
Well, let's take a look at the results that someone has seen using this.
Absolutely. This is a picture that I really love, and you really see the improvement around the eye overall, but it's the crow's feet area where it's most impressive. Now, that I always tell people that's not the main area where I like to see it. We actually have a different picture that I'd love to pull up where it shows some deeper lines and this is the picture here. If you take a close look, if you have a high definition TV, take a close look. Look at those deeper lines between the brow, on the forehead. Those are from the frontalis muscles.
In the forehead, they're almost non-existent.
It's really impressive. Now, it does take 8 weeks, and there's a specific reason for that. That's the skin cell cycle turnover. Try to say that fast 6 times. But the skin cell cycle turnover takes approximately 35 to 57 days. So all of our clinical studies are done at 4 weeks and 8 weeks. This patient in this picture at 8 weeks was really pleased. Once once again, take a look at those forehead wrinkles, those lines in between the brow, even on the cheeks. This woman was very, very pleased because she saw a significant improvement in the appearance of those deeper wrinkles.
Well, we're going to take a look at Suzanne, and let's talk about how I actually use this product, because you did mention that it's targeted.
Yeah, absolutely.
So, Dr. Kirby, how will I use the wrinkle filler?
Well, I want to point out on Suzanne a couple different areas. Now, Suzanne and I had a talk backstage, and I think Suzanne is gorgeous, and she has beautiful skin. But if you could get very, very surprised for me here, Suzanne has some deeper lines on her forehead, and then if you could get very angry, she does a great job of doing that as well. But in her glabella region, she has some deeper lines there as well. So, and the nasal labial line is an area that we're all starting to develop. As we age, we lose volume in the middle of the face, the nasal labial line. So Suzanne is just putting a tiny little bit, a pearl-sized amount is enough to apply, and you apply it directly to any of those areas where you're seeing those deeper wrinkles that you really want to target them specifically.
So again, this is not a full face treatment. This is for targeted areas. So we're going to go right to the areas of concern.
Absolutely. There's some products we'll talk about tonight that are full facial products, and there's other products that we really target for specific problem areas, and it's the stubborn forehead wrinkles that we really are targeting in Suzanne.
And Dr. Kirby, with the wrinkle filler, we're going to see instant results, but then there's also the long-term benefits.
That's exactly correct. I can't emphasize that enough. You get that that appearance improvement very, very quickly, but because of that stabilized retinol, you get that benefit over time as well.
Well, let's take a look again at some results, the before and afters.
Yeah, the other picture is the one I like a little bit better. If you look here on the woman with her the brow lines in between the forehead and the creases along the forehead, the cheek area is where she really noticed the improvement. But after 8 weeks, she saw a significant improvement. And once again, this is a targeted product. It's for those deeper lines, those stubborn wrinkles, fine lines as well, but it's really for those deeper problem areas that you just can't find a solution for.
Now, Dr. Kirby, with a practice in Beverly Hills, I know you have a lot of clientele where their face is their calling card, their business.
Sure.
So I know when maybe they're walking the red carpet or have a big event, would this be the type of product that you would recommend for, you know, your own red carpet event? Or
well, you said, I mean, you said that, you know, I have a lot of patients. Well, I'm my own #1 most egotistical patient, and I always say I'm the least hypocritical dermatologist you'll ever meet, and the same products I recommend to you are the same products I use myself. I use a full facial product we'll talk about tonight, and this is another product I absolutely adore. I use it for the forehead wrinkles, and I could tell you from personal experience it's worked very, very well. But one of those big ingredients there, that stabilized retinol technology, you're going to see it come up over and over and over because it's such a phenomenal ingredient.
Well, this our wrinkle filler available just back in stock on auto delivery. So take advantage. Every 90 days we'll ship this out to you. And we do have something new coming up in the show this morning. The hand, décolleté, and neck treatment. So this is actually a specific product for the delicate skin of the hand, the neck, and the décolleté. You want to treat that specific skin with a product made just for the area, and Dr. Kirby's going to break it down for us. So that's still to come, and if you've used the line and you've been looking for something, you know what, for that area of the neck or the hands, which really show the signs of aging first and quickly.
Oh, yeah.
Now we can treat the area.
It's a very exciting product.
Oh, okay, very good. Now, if you are new to the Neutrogena Dermatologics line, I want you to pay attention to this presentation because we really want you to start with a progressional kit. We really want to build you up and work your way up to the regimen that Neutrogena Dermatologics presents here at QVC. This kit is actually a 90-day, a 3-month kit that gradually works up the intensity of the retinol. And this is the last time we'll see this available at a featured price. Now, this also available with free shipping and handling, so just keep in mind that the price and that free shipping and handling offer will expire when the show ends at 3 o'clock Eastern Time. Now, this was actually shouted out in Allure Magazine's most recent issue.
Yeah.
They said, take the anti-aging challenge, and this would be the product to do so with.
Absolutely. Before we even get into this specific product, let's talk about that ingredient in there. It's that stabilized retinol technology that we all know and love. Now, it's not just my opinion as a board-certified dermatologist, even though I use it myself every single night. Ask any dermatologist, and they will tell you the mainstay of any anti-aging regime, broad spectrum sunscreen, stabilized retinol technology. Why? That stabilized retinol technology increases surface cell turnover, smoother skin, softer skin, improved luminosity. The beauty of this kit here, it's really for 2 groups of people. People who have no idea how to enter the anti-aging market. You might look at yourself and say, you know what, I feel like I'm starting to show the signs of aging. I want to nip it in the bud, and I want to get very aggressive, and I want to I want to get into this battle with other people who are on this anti-aging kick and really make a difference in the clinical appearance of my skin. And it's also for people who may have tried an anti-aging regime in the past, and for whatever reason they quit or they simply didn't tolerate it. So Neutrogena Dermatologics, tons of technology goes in here, but research and development as well. And people said, I don't know how to get started, and I want to start really slowly and acclimate into a great, strong strength. And that's exactly what this regime does.
So how does this progression kit actually work then? Because I see this is what you're going to get, three different tubes. So how does this all work?
Even though the tubes look very similar, they actually have different strengths. So you start with this first tube, it lasts you 30 days. If you're using that appropriate amount, a pearl size amount, it's enough to cover your face every single night.
And it says level 1, this is where I start.
Exactly. So don't even open the other two yet. Pearl size amount of level 1 every single day. At the end of 30 days, approximately 30 days, give a day or two, it's going to end, and you're going to go to the next one.
Okay.
At the end of 60 days, you'll
so we are literally stepping up to the next level of that stabilized retinol technology.
Exactly. And at the end of 60 days, you obviously move to the next level, and you're at level 3. And at the end of that, that's a 90-day, and you have now acclimated into it. You've graduated, so to speak, and you're ready to use one of the other full-face products.
Maybe if I were a woman, Dr. Kirby, that has used a retinol product in the past and felt like I had irritation, I was feeling like my skin was really irritated. Is this a great place to start?
Absolutely.
Because we're kind of taking it slow,
yeah,
not just jumping right into the retinol pond.
You bring up such a great point. Some people have I have skin that's very forgiving, and what I mean by that is men have very oily skin, and as a result, I can tolerate retinols very, very well. Some people have had trouble with retinols in the past. Now, I will say this retinol is very, very different. Stabilized retinol technology makes it much more accessible to the average person. But this kit is for someone who does have a little bit of fear, they don't know how to enter the anti-aging market, or they had an experience in the past that they didn't like. If you use this for 90 days, you will acclimate into it, and now you are ready to use a full facial stabilized retinol product. And
this is the last time we'll bring this progression kit at a featured price of $89.16 with free shipping and handling. So for about $1 a day,
very reasonable,
right? We are now fighting the signs of aging. So what exactly are we fighting? What kind of things are on our face?
Well, let's talk about.
Address?
I'll tell you. Let me answer that question by telling you this. Once again, I'm a board certified dermatologist. My academic credentials speak for themselves, but I always tell people, don't believe your dermatologist, don't believe one single individual. Look at the clinical studies. Look at what multiple people have noted. A dermatologist study was done, and to answer your question, from day 1 to day 30 with level 1, 97% of subjects showed increased clarity of their skin, and that's dermatologist assessment. That's not what the patient thinks, that's what the dermatologist thinks. At level 2, 97% of subjects showed more even skin tone, and at level 3, 100% of subjects showed smoother skin. So we're talking increased clarity, more even skin tone, smoother skin.
Which
Who
to me,
wouldn't want those
yes,
things?
Because that all equals, to me, youthful looking
there you
skin.
go. Well, that's the whole point, more youthful appearance, and that's exactly what stabilized retinol technology gives you. Increases surface cell turnover, gives you that smoother, softer, more supple skin. But here you're seeing that clarity, you're seeing the results are quantified right there. Smoother skin, more clear skin.
Well, Barbara in Kentucky has been waiting very patiently to say hello to you.
Oh, good.
All right, Barbara, it's Gabrielle, and let me introduce you to Dr. Kirby.
Hi, Barbara.
Hi.
Now, Barbara, did you have any questions for Dr. Kirby, or are you currently using Neutrogena Dermatologics?
No, I did order tonight, and I did have a couple of questions for you.
Oh, please ask.
Good.
Go away.
All right. What I was wondering, I had an appointment to go see the dermatologist, and I got a little bit sick and had to cancel the appointment and reschedule it. To go see, like in your office, and to get some things done. And but these things always help somewhat to make you look better. And I always feel better. I don't get anything dramatic done, but just to make you feel better. So what I was wondering was, will the wrinkle filler that I ordered tonight, will that give me any sense of a drastic improvement, or at least a good improvement that I'm going to be seeing?
Well,
not that other people are going to have to notice
I certainly hope so. A lot of my patients, when they come to my office in Beverly Hills, they say, Dr. Kirby, I'm not trying to look 18. I'm just trying to look the best I can look for my age. And that's when I say you should use full facial products, but you should also use targeted products. And you mentioned the wrinkle filler in particular. Clinical studies have shown that it is very helpful in improving the appearance of both those fine lines and deeper wrinkles as well. So my suspicion, as a clinical dermatologist who uses these products themselves, I think you're going to be very, very pleased. So thank you so much for your call today.
Do you think that it would be a good idea to also use the retinol products with that?
Yeah, absolutely. A full facial retinol product is